Today we're here on the Intimate Matters podcast to talk about herbal medicine.
Conventional medications, herbal medications have a way they act. Most time when you have conventional medications come up, we have you tell you, oh, take paracetamol at this dose, frequency for this duration. That makes up a dosage regimen, right? But you don't have that in herbal medicine.
People are using things. Some say they're using it for libido, some say they're using it for fertility, some say they use it for contraction. Looking at vagina and penis enlargement, they're using things. I'm not seeing, I can't pass on the road again. Every junction, vagina and penis enlargement.
That's my problem with herbal medicine. They pick the source in entirety, they run with it, and then they digest it. Medications are not produced in 1 year. It's not done. I'm talking 10 years, I'm talking 15. If we're telling you something hasn't been humanly proven, it hasn't been worked on humans, why do you want to try it?
What are the possible interactions pertaining to putting the modern medicine and the herbal medicine together that people may not be aware of? I'm the son of a herbalist. Right. And because of that, my father has, showed me everything that I need to know about herbs. Right. And, coming from my genealogy, we'll use herbs to treat various things. So what is fertility issues? What is reproductive issues that we cannot treat? How many times have you heard things like this or, seen people say things like this? Or sometimes you see it on social media. And then, yes, we know we are Africans, and then we have herbs. Some will even quote the scriptures that God gave herb for food and for so many other things and for the healing properties. Yes, this happens. And today we're here on the Intimate Matters podcast to talk about herbal medicine as it pertains to sexual and reproductive health. But we're looking at it from the lens and the context of modern medicine. That's why we have here an amazing pharmacist. From Blessing, thank you for joining us today.
Thank you. It's a pleasure being here again.
Yeah. So, as a son of a herbalist, as somebody who understands the knowledge of herbal medicine, I want to ask, what's your view about herbal medicine from your point as a pharmacist?
Okay. And I know people assume that herbal medicines are not to be taken in its entirety, but I would talk about this from my opinion. As a pharmacist, I had to put that so people understand the authority I'm talking from. For herbal medicines, I would say they have both their values and then their benefits. So we cannot in entirety throw them away.
Okay.
So if we're looking at herbal medicines, we're looking at them from the benefit aspect and we're looking at them from the risk aspect. So I would say my answer to that question would be that from my opinion, herbal medicines can and should not or may not be used in its entirety. So I would explain what I mean. Most of the medications we have in recent times, most of our conventional drugs are of natural origin. Most times, most of them are from natural origins. And that's like as far back as before we entered into the 20th century. And in current times, we have definitely drug design, the whole aspect of formulating, synthesizing, and all of that. But before then, we had natural sources for medicines, for medication.
Okay.
One of it I will talk about everyday anti-malarial medication. We have one, the aspirin, or what should I say? Most persons take it for reduction of blood pressure because of the anticoagulant property. And then we have others as well. The goxine is there. And moving on to our normal bitter leaf. Some persons have even used vinegar. Some persons have even used, all of that. But then there's a difference between both of them. The other ones I mentioned are like conventional drugs. Then these other ones I mentioned are the ones that have not even been processed. They are old.
Okay.
They are old. They are they are not refined and all of that. Now, these are the benefits I've mentioned. We have one that would help you with the anti-malarial property. We even have some that have antimicrobial properties. But where we draw the line as professionals, or I would say where I draw the line as a professional, is when these herbal medicines are not standardized. That's where I think we frown at. That's what gives us the panic. Let me put it that way. Because when people hear certain things, I would make an example with reference to my project work as an undergraduate. So I'd worked on Editan, the leaf we call Editan, Lacantera africana, that's the botanical name. And during the course of my working on it, so I worked on it because of its sexual behaviors in male, and it
Okay.
had a tendency to improve libido and all of that. Now, anybody
Well,
listening to
sorry, sorry.
me,
Editan has a tendency to increase
so wait,
libido.
now listen. I want you to listen to something. So anybody listening to me now has only picked that part, just like what you did.
What?
So now the problem is that when I worked on Editan, we did not just pick out Editan in the entirety and say, oh, Editan has these properties, increase in libido, helps with fertility and all of that. We went through a process before we got there. So there's the process of sourcing for Editan leaf. There's the process of extraction with a solvent. Then there's a process of having to concentrate it. Then there's a process of testing it on animals, and then we use the Vista rat. And after that, we now had to also do some form of isolation. So that's where modern medicine comes into play. Modern, pharmaceutical processes and approaches come into play. The place of standardization. Now, Editan in its entirety contains a lot of things. A lot. We're talking about the alkaloids. Alkaloids are known to have the antimicrobial property. They help you fight, microorganisms. They also help you relieve pain. They help you relieve swelling, inflammation. You now move on to talking about the tannins. The tannins can help you with diarrhea. So if you're purging and all of that, it has that property. We have the terpenoids contained in this same Editan leaf. The terpenoids are known to have the anti-cancer effect. So they help you reduce cancer because of their ability to help regulate oxidative stress and all of that. Now, this is one leaf containing more than 5, 6, 7, 10 constituents, right? Phytochemical constituents. And you only heard me talk about sexual property, sexual libido enhancement, and all of that. But it's not the leaf in entirety.
Okay.
Do you understand? So that's my problem with herbal medicine. They pick the source in entirety, they run with it, and then they digest it. Now, when we are doing the whole drug sourcing, the whole work that goes into isolating properties that are responsible for chemicals rather that are responsible for each property, there's now the place of testing. So there is the difference testing on animals, and then there's human. So most of the clinical trials will have, or most of the trials rather will have, are first with animals in a particular dose. So we are measuring the minimum effective concentration, we are measuring the maximum toxicity, minimum toxicity, maximum effective concentration of this medication. So we can tell you a dose. That's why most times when you have conventional medications come up, we have you tell you, oh, take paracetamol at this dose, frequency for this duration. That makes up a dosage regimen, right? But you don't have that in herbal medicine. It's not done because they've not gone through the process of standardization. They've not gone through the process of having to isolate these compounds to know at what dose will they be toxic. So that's my bias about herbal medicines. And then you now move on to the part where they have every likelihood to erupt balancing in the body because there's a whole lot. You're mixing a whole lot. You're boxing things together. The ones that are not supposed to be boxed, the ones that are boxed, the ones that even having to interact with your everyday medication. Mind you, some persons do herbal and do conventional.
Yeah, we're coming to that.
Okay, we're going to come to that. So you see, it's a whole lot. So in as much as we're looking at the benefits, definitely we have to be cultural sensitive because you don't want to be telling our mothers or our fathers that me that just went to school yesterday is coming to tell you that this leave that you're using to do enema is not working, it's not supposed to be, when it's something they've used in years, right? So we also have to be culturally sensitive. So I would say it has its values. I'll say it has its risks. So that would be my opinion when it comes to herbal medicine.
All right, thank you for pointing that out because I'm sure that everyone, just like me, would have jumped at, the sexual function of Editan because this is a leaf, for somebody who is from, the Aqua Cross region of Nigeria. This is a leaf that most times we don't like it. It's not our preference. We have a preference for our farm because it's tasty, but Editan, although tasty, Takes a lot to process before cooking, and it's bitter. So most people, wait till now I'm thinking about it. My father and his friends used to have a preference.
But now at least you know that there's the
Could
benefits, there's
it
the
be? Could
risk.
it be that they were? Could it be that they knew something? And now from now on, as I just come out, if I want go job now, like this, and I know they do. I know they follow and do that one. All right, so it's essential. Like she had said, that the issue is that we have this medicinal properties. Most of them are good, but then is the issue of being able to isolate the things that we need. So let's come to something we wanted to talk about,
Okay.
because we've come to a point where we've getting, what I should say, westernized, if I should say that way. But then a part of us still wants to hold on to, our culture, the traditions of our fathers. So you're seeing a whole lot of mixing culture, if I could say that. It feels like some people wake up today and wear English wear, and tomorrow they're Ankara going back to the norm. So there are people that medically too. So most time when you tell someone I have a problem, most likely a sexual problem, the first thing they ask you is like, "What did you do?" "I went to the hospital." "What happened?" "I'm not really seeing much improvement." Like, have you tried traditional? Have you tried herbal? So, what are the possible interactions pertaining to putting, the modern medicine and the herbal medicine together that people may not be aware of?
There are a lot, but I'll probably be picking one, two, or three examples. And I like that you use that example because in recent time, probably like 3 days back, I was counseling a patient, and when we're done, the patient stepped aside with his friend. So I was trying to sort them out, and the friend was saying, "All this money you are spending to be getting this medication, if I just give you one drink, just one drink, you'll be fine." And in my head, I'm like, my first reaction was I wanted to counter. But then the second thing I did was to hold myself back. And I'm like, okay, there's the cultural sensitivity. I mean, our fathers, our grandparents did all of this. In fact, I probably have had to do these things before I now said, oh, I want to go and read pharmacy. I now had like the knowledge, right? Then what I did was I had to excuse him. And then I called him aside and I'm like, "Sir, I apologize for prying, but as your healthcare provider, I would like to have a word with you." And he was like, "Okay, move on." I said, "I heard the suggestion of your friend, right? It's not a wrong suggestion. And don't get me wrong. I'm not saying that it is good as well, but I want us to balance things. You know, I'm giving you conventional medications. And there's one advice on the other end that's telling you that we're going now, want to go and box things. Sir, please, for now, maybe you can do that one later. But for now, please, this medication I'm giving to you, finish them as prescribed. If you do not see improvement, please come back to us and we'll follow up from here." Now, why do I see this? Conventional medications, herbal medications have a way they act. Most times, they bind to molecules in the body. So they could be antagonizing another molecule, that's another medication. They could be binding with that medication to improve the effects of that medication, either side effect, causing adverse effect. They could also, in entirety, cancel the effect of the medication you're taking. So I'll use a case study. Now, I
Okay.
already mentioned Editan. One of the property or one of the phytochemicals in Editan is saponin. We have the flavonoids as well. These are responsible for reducing blood sugar level. Now imagine that I had given someone an anti-diabetic medication, a medication to help the person reduce their blood sugar level. And the person went on to eat a ditan or went on to take
Drink a
in
detan.
a
Yeah.
ditan. Or probably somebody had told the person, like, this is my patient now. And the person went to go and, after taking your anti-diabetic medications, you now go back and maybe in the evening, you now say, let me step down
Now, wheat.
with a ditan. Your blood sugar level would crash to a significant amount or a significant value or level. What this is going to do to you is sometimes you will become, most times, not even sometimes, most times you would have hypoglycemia. Now, you are coming down to the barest, and we know how glucose can be. Glucose is needed for energy formation. Every cell in our body needs glucose to operate. So imagine crashing it down to the lowest. The person could probably get into shock. You see them rushing the person to the hospital. Hey, what happened? And one thing that for lack of a better word, that doesn't sit well with me
Is that they'll blame the modern medicine.
is that some patients might not be truthful, totally truthful. When you start asking, they said, he was just sitting down, he slumped. He was just sitting down, he fell down. But if you want to probe, collect, and dig in, you realize that there was a combination somewhere. So there is the effect of conventional medicine. Allow conventional medicine to work. If you want to do herbal medicine, maybe out of your own voluntary will, or if it is recommended, and I doubt that would recommend when it's not standardized. We have standardized herbal medications. We have the likes of Jingo Biloba. We have them. We have a lot of them. Now, another one is the use of bitter leaf. When somebody is bleeding, or when somebody is not bleeding, or probably want to stop something like that. I think they use bitter
Yeah, they
leaf.
use bitter leaf
And
when
then
somebody is bleeding.
you now probably had administered a blood thinner with that patient. Sometimes the effect of these medications stay for a long period of time. 1 week, 2 weeks. By the time you now administer, you're wondering why this person is bleeding without stopping, without clotting, not knowing that they are doing an interaction somewhere. So there is need for you to involve your healthcare providers. We're not saying lie to us. We're saying be sincere to us, so we know where to help you. If for any reason you've had to box things, yeah, I'll say it that way.
Okay, so thank you so much for pointing that out, because a whole lot of people feel that they feel that the more the merrier. So if I'm taking this one, I shouldn't just rest on one foot. I should stand on on 2 feet. So they take this one, they take this one, they just be like. And some of them I used to ask, which one will you give glory if it works? Is it a conventional medicine, or is it?
They don't even give us our
No,
glory.
that's the funny thing. If it doesn't work, most times it's the conventional medicine that's the problem.
Exactly.
If it works, the glory goes to the environment. I guess it's because of the ancestors. So let's come to reproductive health. People are using things. Some say they're using it for libido. Some say they're using it for fertility. Some say they use it for contraption. In your experience, right, and with what you've seen, which of this one bothers you the most, and which one does it seem that people fall into the most?
I think all three, if I'm being sincere. I think I was having a conversation with a colleague yesterday, and I told her that I didn't used to think about the issue of fertility up until I started practicing. It's like an everyday issue. And sometimes I go on Twitter, that's X currently, and I see people complain. Why do we have prevalence in infertility in our generation? Why do we have prevalence? Maybe it had been in time past, but they were not as loud as they were now in our generation. Then you now look at the aspect of contraception. A lot of persons want to do away match without the repercussions of it. And then look at libido. People definitely want to get sexual satisfaction.
Yeah,
So
because of
all
the
three.
sexual craze on the
Exactly.
internet.
So as a healthcare professional, all three will probably pique my interest. Now that's where people get them. Because there's a market already. Where people will tell you you don't want to start selling something that there is no need for. I also do that most times. I tell my students, you don't want to write in a niche where, there is no need for. So imagine that you have 1 million people, 2 million people waiting for you to give them a solution, the messiah to their problem. Mind you, most times the food we eat, the medication, some persons these days have been diagnosed with chronic illnesses at a young age. Maybe they'll start taking some medications that might have effect on hormonal balances and all of that. So they really want a savior. They want a savior. And you are standing there. You just mixed Editan with Nkong, with Utasi. As long as it's green. They'll just believe that,
Yeah, it's natural. It's chlorophyll.
exactly. So they would want to get it. They want to grab it. So I have a problem when these things do not go through the proper route. regulatory bodies. They are not tested. There's no clinical trial. Medications are not produced in 1 year. It's not done. I'm talking 10 years. I'm talking 15. Because there's a whole lot. Remember, I told you my project work took, imagine how long a project work takes. And that's just like with a pilot study. Imagine having to blow it up because you want to serve a population of, let me say, 1 million, 2 million persons, right? So I have a problem when these herbal medications, herbal medications are used particularly for fertility, libido, contraception. Because looking at it, these are hormones in play. It's a power play of hormones. So you are distorting basically something that gives a balance to the human body. Do they work? Yes, they would to an extent. Because, like I said, they contain phytochemicals that could be responsible for solving these problems.
Okay.
But because they come with other things, so you are not only taking these medications for the fertility, the libido, the contraceptive effect of it. There could be one targeting cancer cells. There could be another one targeting your eyes. There could be another one targeting, glucose production. There could be another one. So it's like a chaos. So if it is not standardized, I do not buy into the idea of it. So yes, can they work? Yes. But can they cause more effect than more harm than the benefit? Yes.
All right. So just on that, let me just point out because I just stumble and I see that in the context of reproductive health and sex, people are now using um aloe vera aloe vera the gel. It's quite slimy, so people are now using the gel and sometimes coconut oil as a form of lubricant, for people who may have vaginal dryness or people who feel that the wetness is not waiting to
Not
their
enough.
level. So how safe is this?
Ah, you're even talking about aloe vera. You're talking about coconut oil. I recently saw it with about snail, the
Yeah,
liquid
yeah, yeah, yeah.
from
The
snail.
liquid from snail. I think a woman brought here how much she used it with her husband, and she had like the best sex of her life.
As healthcare professionals, we listen, we don't what.
We don't judge. We can't
Exactly.
judge.
So we only give our professional advice. So in this case, coconut um goes, it's definitely acceptable on the skin. It's definitely okay on the skin. Aloe vera gel, I will give same sentiment to it. But again, where I would draw the line is I've the pH as the pH level, because we're talking about the vagina, right? And it's supposed to be maintained at a particular pH level. So these things now, are they tested enough for suitability with different skin types? Are they tested to the pH level that is acceptable? Because we have natural flora in our body, in our vagina. Let's use that as an example. And if we're going to be introducing something that's distorting the natural flora, either because of how the acidity level is or the alkalinity is, then we have to be careful. In as much as you're seeking sexual pleasure, you want it to be wet, you don't want to be wet, you want to be dry, you want whatever it is, you should treat your body as something that could have a boomerang effect if it doesn't go
Okay.
right. So will I advise it? I won't, because most times, most of these products that are paraded as aloe vera gel, coconut oil have preservatives. Alcohol might be added to it. And they might not be suitable for skin. So why don't you just do the normal lubricants that have been tested, they've been tried, the pH level ascertained, sensitivity to different skin types has been ascertained. I think it's best. Can we just, in all our experimenting, can we please try to pipe it down? Yes, take it slow. That's what I would
So
advise.
my neighbor may argue that you're asking me to use the number. They draw like the snail on they draw. They draw like
Funny
an
thing is, if you want to
they
now
draw
look
like
at, if you want to look at it, if you want to look at it, food play a huge role. The intimacy level with your partner plays another role, right? What's your mood like? Workload. So there could be non-medicinal approach to battling all of this. It doesn't have to. Most times I advise people, even when I'm a pharmacist myself, I try not to start the drug route. Can we deal with this, the non-pharmacological approach, before we now think of medications? Because it could be lifestyle modification we just need, and not these things. Because by the time you start introducing the aloe vera, the coconut oil, some even go as far as snail.
Yeah.
I wanted to say that snail in Yoruba because I think it will give me the effect that I need. But nah.
But it's, people say, is it, people already, maybe, the thing is, where my mind is going to. Snail already looks like something, right? So maybe people just,
Okay.
snail already look like something.
It's
So
a
maybe,
fetish.
yeah,
I
so
agree.
people
I
just
agree.
be like, if you look like, why, for just function for that side. But
Exactly.
it's
I
quite,
agree.
important that you look at your health and you look at the way that it's going to function with you. Like I usually tell people, like you said, the boomerang effect. At least when you pick this one, they can tell you that if it doesn't work, this is what you are expecting, and you know that as a side effect,
As a side
right? So they
effect.
tell you that these ones you're taking, will they tell you if it doesn't work, this is what
They
you
will
should
tell
be
you
expecting.
no side
And you
effects.
talk about, yeah, and you talk about the skin type and the rest. And we look at when you're doing the dosage regimen, they're going to tell you maybe by weight or by age or whatever. If you are this weight, take this,
Exactly.
not minding your
Those
age.
calculated.
But this one, man tall like Iroko, short like me. One
One
shot.
glass.
Man, one shot for everybody. So let's go to this one, the one that is killing everyone. Using, how does this thing work? They say it works. Does it really work? We're looking at vagina and penis enlargement. They're using things. I'm not seeing. I can't pass on the road again. Every junction, you hear loudspeakers everywhere. They're shouting.
The first time I heard about vaginal tightener was as an undergraduate. A woman walked into our hostel and we're hearing, take this for, and it's again in a Pepsi bottle, or should I say a soft drink bottle container. So like, take this, your vagina will be tight. And in my head, I'm like, what's going on here?
And when you did this one.
Why did you have to? I washed my hands off, please. And it was intriguing. So when I now had to do I write papers, research papers, right? I discovered that the vagina is elastic. It would come back, regardless of how. I don't want to sound offend. I want to be careful with my choice of words, so my words don't come off as offensive. No matter how
Stretch. Yeah,
stretched should be a
stretch will
better
do.
word. Yeah, it is. It will come back. Childbearing, whatever it is, it will come back. I don't think the pressure should be on you tightening it. Funny enough, you could talk about tightening your pelvic walls. You could talk about toning the exercises. Talk about the Kegel, and then the penis enlargement. That one is still another strange thing to me because there is there is a time in a man's life where growth doesn't happen again, right? So at what point, what exactly are you doing to enlarge? What exactly are you enlarging?
They're overriding the time, overriding the genetics. So the penis has stopped
Wow.
growing. They bring something.
Okay. So and you're not scared that you're altering something. You're not scared. Because to me, like I said, there's already a market for those things. So whether it is scientifically proven, whether it is backed, in fact, most of the evidences, because I had to sit with myself when I got your question, I had to sit with myself and go through these things. Most of the evidences have not even been tried on humans. And from my understanding of conducting research, most times the dose used for animals are usually higher because they are more tolerating. They are more tolerant. If we give a pain reliever to a mouse or a mice rather, or a rat, should I say at 500 milligram, best believe, to probably maybe instill pain, to trigger pain or something, if we give that same dose to a human, that human can survive. That's how tolerant they could be with dose for medications. So if we're telling you something hasn't been humanly proven, it hasn't been worked on humans, why do you want to try it?
Yeah, maybe they're just using the humans as, and it's bad because they're now using the general population.
That's the problem. And one question I feel like learned people should be asking: where's the proof that this thing has undergone scientific, profiling? Some don't even have, should I say, the
Drug
regulatory,
literature.
but do you understand? There is no.
Oh, the small white book is not even there. That small white book they used to put, and I think, like you said, it's all about the desperation of the people.
It's the desperation.
So people, when people are desperate for something, they will take almost anything. Without you dying, and with the way sex is marketed now, the fact that you need to attain a certain height, you're a man, you need to last, you have to.
That you're a man,
No,
gone.
no, you're a
Might
man. You
even
need
make
to be
you.
like a man. You're a man who should show you are a man. And I see
Exactly.
people like when they go for enlargement, they're looking for like 7 inches penis, for example. And I look around and, like you said, scientific studies, we're looking like 70% of men don't even get to 7 inches. Now, so
So
when I see people come out and be like 7 inch, I'm like, and some people say 8 inches. 8 inches, we're looking like 8% of the whole man population.
funny
In the
enough, in
world.
comparison to their height, and you're like,
So one day, while I was working in the construction space, I picked a tape and I was like, I've been hearing this thing.
you want to
Let me man look at inches, like for
as a
real, for real. Let me
scientist.
look at this thing for real. So I was like, I called the person, I'm like, show me which side is inches because I don't want to make mistake. And I was shown and I started drawing the tape. And I think I posted it on my social media. I was like, see you, this is 5. This is 6. This is
Then 8.
you people that say you want 7 and 8 inches. Is this the kind of thing? All right. It's
And
well.
and most times, what people don't understand is that, like we said, these things have side effects, and they're not pronounced because maybe these things were not studied. You do not even know the effect you're expecting. You don't know. Some persons might now start having priapism. I think we've had a conversation
Yeah.
regarding enhancers at some point. Some persons might start having mental disturbance. Some person might have anxiety. Some persons might even be hallucinating because these are likely side effects. Hormones, a lot of alteration going on in your body. If the conventional can even have the side effects, even when they've been isolated, they've been separated to say, okay, this is just the active ingredient. Now, talk about something that has more phytochemicals in them. So there's a whole lot. And I think it also boils down to misinformation, health misinformation, which I'm grateful for this platform that we're doing a whole lot of health communication. That's something I'm passionate about because health literacy gaps, I would classify all of this under that, is one reason why somebody would accept to get something that has not been, certified, scrutinized, profiled from somebody and would gulp it into your system. Your kidney metabolizes this. You're not even thinking about the load on your kidney. You're not thinking about, and most times I don't really blame the prevalence of kidney issues these days. Because if you look at it, it's a cascade of events. It's something, it's a cause and effect thing. It's running in chains. So you take something for penis enlargement, you take something for vaginal tightening, forgetting that you are introducing something into your body and you're wondering why your kidney has so much to do. And then you're having problems with urinating, probably the frequency, the volume. And before you know it, you're having swollen limbs and you cannot trace the cause of your problem because what you're even taking does not have a known source. If you want to ask these people, where do you get these things from? The source, some are from their backyard, some probably some roots, some stems, some leaves boxed together, and then they are bringing out the juice to give to you. So you are making it difficult for us as healthcare professionals to give you the advice, the care that we should give. So you're not only dealing with your vaginal tightening, you're dealing with your kidneys compromised, and some come down with recurrent infection because you keep on distorting the flora of your vagina. And you're wondering why you keep on treating and treating. Before you know, you accuse a faithful partner of cheating when you brought the problem
Innocent
yourself.
me.
I didn't say that.
Innocent
I
me.
didn't. I didn't.
All right. So this is why we have conversations like this. That oftentimes it's not just about your reproductive health. That some of those things you do, get to affect
True.
other parts of your body. And if you're just joining us, we're discussing herbal medicine as it pertains to sexual and reproductive health from the point of modern medicine with the amazing farm blessing. And we know by now you must have subscribed to this channel. So if you haven't, please do well to subscribe and also share it to other persons, and do well to follow us on all our social media platform. We're on Facebook, we're on TikTok, we're on Instagram. And then you can join our personal WhatsApp group. There you can interact with us and you could tell us topics that you want us to talk about. So a fan before we let you go. So what kind of information, like we've said, most people are doing like what we usually say conference service, right? So some people want to be here and there. What kind of information would you advise that for somebody who you want to take about medicine, but you're also open to conventional medicine? What are the kind of information that if you're approaching care, you should let your healthcare personnel know?
First off, I would say if there's one person you should not lie to, if there's one person you should never lie to, your healthcare providers. Because whatever you would tell us would account for our subjective data and could also influence assessment. It could influence our plan. It could influence outcome. Right? So it starts from somewhere. You come, you lie to us. That lie will meet you at your outcome. Because like it or not, we are building on something. It's in as much as it's evidence-based, we want to know the background. How did it start? So you don't want to lie to us. If you took herbal medicine, in fact, once you come into the hospital, start shouting it. Oh, I took, I drank. Tell us the duration. How long? What route of administration? Enema, your mouth, your skin. Tell us. We want to know how to help, especially if it's a case of toxicity. We want to know how to arrest the situation. If it's a case of, co-administration with conventional medications, what time interval before you took your conventional medication did you take your herbal medication? And what were you taking it for? What leaf was it? Because if we know the leaves, we can tell the phytochemicals involved. You can tell how to arrest it. So all the while you are talking and we're looking at you, we are trying to arrive at a destination for you. So you don't want to lie to us. Again, I said that I'm not in entirety canceling herbal medicine. I told us already it has its benefits, it has its risk. If it can be standardized, it's not a problem. We would give it, we would encourage it. But until then, you can try to stay away from it. I know that is what I'm saying now. To enter some people from one ear and come out of the other. What I want to say in essence is help us to help you.
Okay.
Help us to help you. We know that our mummies, our daddies, we the young ones cannot advise you because you've been doing these things even before we were born. But now that science is evolving, now that we are getting to become more aware, help us. Because looking at it, the prevalence of kidney issues these days is a lot because your kidney plays a huge role in metabolizing these things. At the end of the day, to come down to having it, either excreted, secreted, taken up into the body if it's important or whatever. The body just has a way of excreting it or making it become a waste product or recycled into the body. So you want to tell us. So we know what we're doing. I made an example with the anti-diabetic medication. If you are taking something before you came and you're already having signs of hypoglycemia, you're shaking, you're sweating, People would want to know. Start confessing in that sense of it, right? You don't want to lie to us.
Treat me as your pastor and confess so that help us to help you. And as usual, thank you so much everyone for allowing me to act as the son of a herbalist and as a herbalist in extension. But just before we allow Fan Blessing Abai to go, I want her to advise me as the herbalist himself, right? Thank you for advising my people. So now advise me as the herbalist itself. This thing is a thing of my family.
Okay.
I was born to see it. My
Okay.
forefathers long before me. My forefathers, when they were roaming this Africa, were using these herbs. So what would you advise the people that are actually into doing this herbal stuff?
You can do it the conventional way. Yeah, if your father is a herbalist and you're not a pharmacist, there's no big deal. It's just the same thing, but we are modernizing it. You get. So you can decide to take the knowledge further by going into the health system, like going through the route, get educated, come out, get certified, and we have a lot of them. They would even told the route of there's a branch of pharmacy called pharmacognosy. They deal on natural sources, and then they take it over to the pharmaceutical chemistry where it is now formulated, synthesized. There's a structure to the constituents before they now design it as medication. So you see that there's a whole lot you can use. You can help us with as regards your knowledge as a herbalist. You can decide to further. So there's no crime in being a son of a herbalist, but you can do it in a more composed,
tasteful way,
demure way.
All right, so this is me for this episode, being the son of the herbalist, and also the herbalist in extension, being very grateful to Fan Blessing Abai, amazing health communicator, health writer,
Don't make me blush.
Bass of purpose, amazing. Thank you so much for sharing from your wealth of knowledge. This is the Intimate Matters podcast, and here we talk about everything that contains to your intimate matters, sexual and reproductive health. And as always, please do well to subscribe, do well to share these videos to everyone that should share this video. Share it to your papa and your mama. Share it to cool sons.
Share it respectfully.
Yeah, herbalists like me. Share it to all the herbalists out there. We're proud of our traditional medicine. We're proud that we have herbs and leaves to use to help ourselves. But if anything is worth doing, it should be done in the right way. So until we come your way next time on the Intimate Matters podcast, I am the acting son of the herbalist, Nosa Kwawokban, and this is goodbye for now.